Thank you for joining. Want to turn it over to Suzanne to tell a little story that kind of sets the tone and the context for today's conversation.
Thanks, Sarah, and thanks to you at Icario and the health plans for putting this on today and for the opportunity to talk about this really important issue. We know that as we unwind the public health emergency, this is going to be a huge coverage event that will impact the coverage of millions of Americans. So really appreciate the opportunity to talk in detail about this today. And we know that storytelling is a key part of making this complicated program that is Medicaid understandable to people. So just wanted to start with an anecdotal story that was shared by one of our team members at Nevada Medicaid, basically talking about an experience they recently had in Reno, Nevada, getting their hair cut, which explains the photo that we have here, and just kind of sharing information about their job with Nevada Medicaid and hearing during that experience about how the person that was doing the hair cutting had just recently joined Nevada Medicaid, and just how much of a lifesaver it has been for them during this difficult time of the public health emergency. And we do know that people really value the coverage that they receive, that healthcare is really important to people, and that there's a lot of value in the safety net. So just want to use this opportunity to focus on the importance of Medicaid. And here you can see some high level numbers related to the public health emergency. And I think I'll hand it back over to Sarah to talk a little bit more about this slide, but thank you. And just wanted to start this with, a realization that these policy changes and legislation really have real impacts on the lives of many Americans. So thank you, and I'll hand it back to Sarah.
So with the expiration of the public health emergency that will likely happen this year, if we as the industry and states don't go through this process in a efficient and structured way, 80 million people could lose coverage. So obviously this is top of mind to everybody right now, and absolutely critical, especially with the number of people and the surge that we've seen with the public health emergency. So in setting the context for today's conversation, we have all experienced that eligibility, enrollment, and redeterminations can be really difficult, even prior to the pandemic. And it varies dramatically between states and how the coordination occurs. However, we know that with COVID, the government declared a public health emergency. And so we saw this surge of over 10 million people who enrolled in Medicaid. So that's 10 million people that may not have had coverage ever. So now the states and plans need to manage this new beneficiary recertification and the dates associated with it and the data in order to effectively get through the new redetermination process with millions of new Medicaid beneficiaries. So one of the central components to this is the education. The challenge is people may not know what recertification or redetermination is. They may not even know that they have to go through it. And so a critical component is the education that's going to need to take place even before the public health emergency is lifted, so that we can get people to go through the process in an effective way and to avoid millions of members losing coverage. So a question we get a lot is, why are we addressing this now? Why don't we just wait until the end of the public health emergency and then we'll address it? Well, this is because there is a massive extended timeline in order to go through the process to make sure that everybody continues their coverage without a coverage gap. And it's really to set the stage for an approach that fosters a timely, organized, and a successful process. And here we've laid out the expected timelines that CMS has published. and guidance to help states and health plans. So CMS expects states to catch up on applications that are pending at the end of the public health emergency and to have resumed making timely and accurate determinations of eligibility on new applications. And we know this is to ensure timely access to coverage for all eligible individuals, because the PHE did not inhibit or stop the new application process. But states may take up to 12 months after the public health emergency ends, which is current guidance may change, to complete the pending verifications, the redeterminations made based on changes in circumstances, as well as renewals. So states and plans are aligned in this goal of trying to get people to effectively and efficiently go through this process without people losing coverage. Both have a shared need to drive members and beneficiaries to websites and resources well before they lose the coverage. This is absolutely critical because at the point where they're going to lose coverage, it's very hard to activate members and beneficiaries. However, there's large variation in how states and plans are working together. Some states are working independent of the plans and driving the process, where the plans are essentially, need to respond to whatever the state process is. In other states, we've seen a really great collaboration, like in Nevada, where this is done in concert so that everybody is in lockstep on making sure members get the coverage. And interesting, what we've learned is that in some states, dental managed care organizations have been the best at this and the most effective and proactive in this area. So something to learn from a different area than traditional medical managed care. So we have a couple of different strategies that we're going to discuss. The first strategy is it's essential in this process to ensure that states and plans have the most up-to-date contact information. Suzanne, this is something that you and I have spoken about at great length. Can you talk a little bit about how you've experienced this? What are some of the challenges that you've seen and ways to start to address the process?
Sure. Thanks, Sarah. So I would say probably one of the biggest challenges that states are facing is kind of the uncertainty surrounding the timing of the public health emergency, which makes messaging a little bit more complicated, right? You want to deliver the right message at the right time. And so right now at the phase that we're in, where we know the public health emergency will end, but we're not sure exactly when that's going to happen, we've really been emphasizing the importance of updating your contact information as is displayed here, and trying to work with a broad array of our stakeholders to have everyone, kind of say, have you moved in the last 3 years? Please make sure your contact information is updated so your health insurance will move with you. So we've just been working with a variety of different stakeholders, and we do know from focus groups and surveys that members really do value providers and their managed care organizations as really valued and usual sources of information. So think that having providers and managed care organizations really as key stakeholders trying to do everything they can to help states ensure that contact information is update is really critical. I think, also working with a variety of other consumer advocacy groups, really thinking about providers broadly and where people routinely interact with the healthcare system, pharmacies, other places, just kind of like this broad approach to try to get everyone to really emphasize the importance of keeping your contact information updated, because we know right now that's the really critical piece. And without knowing with more certainty about when renewals and redeterminations are going to begin, this is really the key message for us at this particular time. So that is kind of what we've been doing, but did just really want to emphasize the importance of plans and providers and working with states, because that is where our members routinely get and expect information about their healthcare coverage.
So our second strategy here is to really build a foundation of trust through education. Suzanne, can you comment a little bit about the education that you're seeing and effective ways to do that?
Sure. I think it's right now, sending everybody to the state's eligibility system. So even that, as a lot of states have complicated systems to navigate, and Nevada certainly falls in that band or that group, where the Medicaid division that we're part of is part of a large umbrella human services organization, and a different division actually does eligibility determinations. But it's really trying to push that one eligibility website, Access Nevada, and I think we have a slide on that upcoming, but that is the key place to go and make sure that your contact information is updated. So really just trying to get everybody on board with that same, there are multiple avenues that you could do this, but trying to simplify the messaging and drive members to that particular site as the best place to go and update your information has really been what we're saying, trying to do it early and often, to your point about cadence and regular outreach and consistent messaging.
So we've learned a lot in COVID, and we've learned a lot about how to educate beneficiaries on things that they need to do to improve their health or to stay engaged in healthcare. Can you talk a little bit about what we've learned from vaccination efforts that we could potentially apply in the context of redeterminations?
Yeah, I think it's again back to that source of trusted sources of information, providers, managed care organizations. One of the things that we learned through our vaccination efforts and working closely with the plans was that they were most successful when it was like a bundled resource, or like you could get your COVID shot, you could also get your flu shot, just kind of having a one-stop shop for health information and needed services was really, I think, the most effective approach based on information that we received from our plans. So I really do think it's, just focusing on those trusted sources of information. And we have also seen that through COVID, and having trusted community partners has been really critical, especially when you look at some of the health disparity issues. And we certainly saw that in terms of the impacts of COVID and COVID vaccination rates. So really trying to use some of those lessons in terms of where do people expect and like to receive information, and what types and what modalities of communication are most effective. And I think, a broad-based strategy is what we've heard is best, not any one thing in particular, but multimodal, and just making sure that the information is consistent and available via multiple modes of communication.
So one of the things that we have heard more and more is when people are outreached to, sometimes they don't know, is this like a scam? Is it real? And so some of the core competency that we've uncovered is really making sure that beneficiaries have the right education so that they know that it's not a scam. So they know if they have to enter sensitive information into a website or a portal, that it's trusted and that it's not to be suspicious in any way. So I don't know if you've seen that at all, but it's something that we've heard routinely.
Yeah, and I think that's particularly important and relevant when we think about what in the Medicaid world, it might be surprising, but for us in some ways it's like new strategies, things like texting, which we all rely on every day in our daily lives, but really thinking about that as a strategy to meet our members. And I know we'll talk a little bit more about some of the challenges related to that, but I think that that's a perfect example of a way that people do want to receive information. We know that our members don't want to rely only on mailed notices, but I think, when you think of something like texting, the educational piece around like this is a legitimate communication is really important. So I'm trying to find that balance and make sure that we do leverage the benefits of that type of technology, but also address concerns related to privacy and security. And, is this a legitimate communication?
So, when you think about the multimodal communications, how are you working with community partners around this and the process?
Yeah, so kind of where we are right now is the update your information, but quickly shifting to the how can we even get that message out, and doing a lot of digging in with our plans around who texts and who can text, and at the state level, again, not to get in the weeds of TCPA, which I know that you'll talk about a little bit later, Sarah, but just trying to work through some of what's happening on the ground now, and what are our potential avenues for really increasing quickly our capacity and ability collectively to communicate via all modes with our members.
I think that capacity issue is really central to this conversation, and it drives a lot of the reason that plans and states are reaching out to ask, why and how can we do multi-channel communication? We were speaking to another state at one point, and the biggest hurdle or barrier in this is the thought of people flooding the service centers with going through their renewal process and the waits and the delays and what that could potentially do and the implications for this population. And so while we know that certain populations, especially those without broadband coverage and access, direct mail, live agent will be more important. Really, a lot of the populations that use Medicaid respond better to digital modalities such as texting and email, because it's something that they do more in their daily life. It's part of their kind of daily workflow, if you call it that, but it's natural instead of filling out a form and mailing it back or picking up the phone and speaking to somebody. But if somebody isn't communicating, what we've found is that there has to be a strategy, and I know we've spoken a little bit about this, Suzanne, to do channel switching. So if somebody isn't responding to text, maybe their phone was turned off. And so, okay, now we need to do direct mail, and really understanding the channel as well as the messaging that resonates with the beneficiary so that they understand it. It's a way that's culturally relevant in the right language, and in the right channel that they can respond to effectively. So we'll spend a little bit of time on TCPA implications for this. This question arises all the time around how do we text? Is it problematic? So TCPA compliance is central to this conversation, especially as it relates to texting. So in healthcare, for the most part, TCPA allows plans to communicate via text. There are a couple of exceptions and nuanced components around that, but for the most part, texting is allowed and is an accepted form of communication. There have been some recent court cases where there have been third parties acting on behalf of subsidized health insurance plans where they're outreaching to people to enroll or to verify their eligibility, and they've been, there's been a TCPA issue brought to the attention of the FCC. We know that what the court has said is that that's okay. That type of outreach and that kind of communication is acceptable under the TCPA. And from a policy perspective, it makes perfect sense, because if, state Medicaid departments can't get in front of this group via text, and that is one of the most commonly used forms of communication, that creates a significant barrier in trying to get these individuals re-enrolled into the process and for coverage. But one of the areas that we've been hearing a lot of chatter about is questions to CMS directly, asking for guidance on this. because there still is question and a little bit of uncertainty as to once this mass texting starts to happen with the redetermination process, is it going to be an issue? So stay tuned as to whether CMS responds to the questions. I don't know, Suzanne, if you've heard anything about that, but it's something that's on our radar for sure.
I know it's something that's being monitored very closely. I do think that there's some additional guidance from the FCC that has come out in the last year that does provide additional clarity around states' abilities to directly communicate on eligibility related matters. So I think, just getting it's pretty recent. And so I think a lot of education around that piece is kind of what we're working on too. With our internal counsel and others. So I do think that there's additional guidance out there that is helpful as states are trying to work through these issues in, the very near term.
So let's turn to the third strategy, which is tracking results and communication preferences. Suzanne, this is central to what you're thinking about and what you're working on today. Can you speak a little bit about this?
Yeah, absolutely. So I think, in addition to the different modes of communication and understanding better how our members like to receive messages, also really making sure that the messages are culturally sensitive and appropriate and, linguistically appropriate, and really trying to set up systems to track what resonates with our members, both, again, in terms of modes, but also the actual messages themselves. So I just think it's really critical. And, something that we've heard based on some focus group work is, it's not incredibly helpful to our members to frame this in a way that talks about the unwinding of the public health emergency and some of the ways that we typically, from a Medicaid agency, talk about this issue. And it's really more helpful when those messages are directed at here's what you need to do, and not even so much of the here's why, which I think, we kind of always feel like we need to explain and here's why. But I think what we're learning is that it's really just, the nuts and bolts of what do I need to do to keep my health insurance coverage is the most important, and make sure, again, that those messages are being provided in culturally appropriate ways and by us and other trusted partners.
Suzanne, do you anticipate there to be a different strategy for the 10 million plus beneficiaries that are new to Medicaid and may not have ever heard of this process before?
Yeah, well, it's something that we're thinking about a lot, and even trying to identify in our population how much that is for us, and really thinking through that, because that is a nuance, right? If you came on in this program during the time of the public health emergency, this is all new to you. And then I think also just the realization that for some of our members who have been covered previously, in some cases it's getting to be 2 or so years that you haven't done this. So even if you have historical experience, it's hard to remember all of the things and forms that you filled out a couple of years ago. So I think both are really important pieces, and I do think maybe some additional education or tailored messages will be helpful, but don't want to lose the fact that a lot of time has passed, even for members who have done this process before, but then also certainly recognizing that it will be a first-time process for many.
Thanks. So, questions to ask to help shape the outreach. We've spoken a little bit about this, but can you speak to how to draw members in? I know, we use different tactics to target populations so that there is a high degree of relevance. So reaching out to somebody who is a dual is going to be different than the way you outreach to somebody in their 30s. How do you draw members into this and make them say that this is real, urgent, and absolutely necessary?
Yeah, I think you make a good point about the different eligibility groups and different strategies there. And also just, again, the different modes of communication, things like, we've heard lots of strategies around for the mailed notices that do go out, some sort of like envelope that says, time sensitive, or, I just think in every way that we communicate, there are going to be different strategies based on the mode and the specific population to which we're targeting each key message. So that's just one example, is like when you think through all the different modes, what can you do to highlight in a brief and concise way to signify the importance of returning renewal paperwork for those individuals that aren't able to be renewed by an ex parte process, for instance. So I do think that, relying on technology as much as possible to reduce the potential for administrative coverage losses due to just not filling out renewal paperwork, because again, it's either your first time or it's been several years since you've done it. So kind of thinking through the technology aspects, but then also the messaging, and what can we do to just highlight the importance of this in every way that we're communicating with our members. And again, I think relying on plans and providers, knowing that our members really trust and are used to getting information from all of the plans and providers as really trusted and normal sources of information about their healthcare.
Yeah, that's something that you raised is, the time sensitive notices and the big, headline, the headliners that cause people to respond. And I think that really goes to what's in it for the beneficiaries. And sometimes people may not have used their coverage at all during this period of time, and others may have. This has been a lifesaver, literally, for them. And so trying to flag in a very prominent way, whether it's by text or email or mail, that you could lose your health coverage, something that's very basic, simple, easy to understand, that catches their attention, but in a way where they will have trust around the source of the information, the source of the call to action, so that they're not skeptical around, oh, this is another, scam that I'm, being messaged around. I'll turn it over to you, Suzanne, to talk a little bit about, how you work with CMS around this.
Thanks, Sarah. Yeah, so I think this is a key piece, right? Reporting and monitoring, and we're all really interested and want to minimize coverage losses. So there are current enrollment reports that states provide to CMS. Current monthly enrollment has things like call center volume metrics, number of applications received, number of individuals determined eligible, and total enrollment. And that's on the standard reports that states send to CMS. And those are then, with some data lag and time lag, then reported by CMS to the public on those metrics in particular. But states also have, many states do additional enrollment dashboards. Nevada does, and we post on our DHHS website additional information around processing time and pending applications. So I think it's just critical in terms of working with your stakeholders and level setting about how this is all enrolling and being transparent. I think that the data dashboards are an incredibly helpful strategy. And you have things here like monitoring by zip code, again, just to get a sense of how we're doing in terms of protecting coverage and where we're seeing coverage losses. It's really critical, I would say. Some of this is evolving. And Build Back Better, which we all know is in a little bit of limbo right now, did have additional reporting and data requirements. And so that may come to fruition either through Build Back Better or additional guidance from CMS, but really looking at additional metrics like the number of eligibility renewals that have been initiated, the number of beneficiaries renewed, individuals with eligibility terminated, and then more granularly for those terminated, how many were for procedural reasons that we talked about, like not returning your renewal paperwork, and then those that were terminated due to a change in circumstance, such as being over income, and then how many have transitioned to the exchange. So again, some of this is to be determined, but I think for states that want to keep a close eye on this and are really states and the federal government, certainly the federal government, CMS has been so helpful and proactive and just dedicated so many time and resources to working with states to help ensure and protect coverage that I know, that there's probably a lot more to come on this, but did want to flag like what the current status looks like in terms of enrollment data that states currently provide to CMS, flag that many states also provide additional dashboard level information at the state level. And I think just a lot of interest in focusing on this as a strategy to promote coverage and monitor where coverage losses are happening, and keep an eye out for health inequities and those really important issues.
Do you, obviously a lot is dependent on the Build Back Better Act because there's a lot of different reporting components that are contained in that, as well as, outreach requirements. Do you anticipate states, asking for different things from the health plans, or there's new processes that they may have to go through, or is it too early to make that assessment?
I will say we haven't gotten there in our state level planning with our managed care organizations. We're actually setting up bi-monthly or bi-weekly, twice a month, meetings with the managed care organizations to talk through strategies, all things from, outreach and education to then, when we're in a different phase of this monitoring. So, I think we're all in this together and all have a shared goal of promoting coverage. So I wouldn't be shocked to see anything like that. But I think, we're just not quite there yet, at least in Nevada, and are still primarily focused on that phase 1 communication strategy of update your contact information. So here is our Access Nevada website, which is the key to Medicaid eligibility in the state of Nevada. So this has been our primary messaging, is to go to this website and update your contact information. Again, certainly there are other modes, and managed care organizations, even if they have updated contact information, can provide that to the state. So there are a variety of ways of getting your contact information updated, but just to simplify messaging, this has been our primary strategy, is to ask our members to come to Access Nevada and make sure that their contact information is updated, so that when renewals and redeterminations do start going out, we have a better likelihood of getting them to the right address. We know that this is really transient population in the last couple of years in particular, have seen a lot of disruptions in terms of people like evictions and just a variety of things, but in general too, even pre COVID and public health emergency, just want to recognize that the Medicaid population does tend to be transient.
Go ahead.
Oh, okay, thanks. So this is just, I think, working with the marketplace. We mentioned a little bit about that earlier, but is a key strategy. And we know that many of our members have gone back to work and have had income changes during this time period. And I think the goal is just coverage, right? So for those individuals want to have a seamless transition to the marketplace, and Nevada is a state-based marketplace, and really working closely with them to ensure that those over income folks that are part of our population have a smooth and seamless transition to marketplace coverage.
You've mentioned before that you feel really confident in the process and how people are accessing coverage with the exchange. Is there any particular component where you can say, yes, this has gone really, really well, and something that other states or plans may even want to learn from?
Yeah, I think Nevada's historically done a really great job in terms of marketing and outreach and education through the exchange, the Navigator program, and they've gotten some additional resources there, but also from the technology standpoint, pretty smooth transfers of applications back and forth between Medicaid and the marketplace. So I think in that regard, state-based marketplaces might have a little bit of an easier time with this, knowing that, the FFM has a lot on its plate, and I think requiring individuals in those states to go back and complete their application at the FFM, where ours transitions pretty seamlessly from Medicaid to the marketplace.
So as we continue to work with plans and states, we have found that what is fundamentally necessary is to build a really detailed strategy or playbook that the states and the plans can work from in a coordinated way. CMS and states have provided guidance around this. There's published informal kind of sub-regulatory guidance around what some of the what things that plans and states should be doing. But really, it needs to take into account a variety of different areas, and a couple are, technology. That's a big variable and factor as part of this. And how does the technology work between the states, the plans, CMS, and even third parties as well, who are managing some of the eligibility, different access points. So what are areas and ways that members and beneficiaries can actually renew their coverage? Is it in person? Is it telephonically? Is it via other channel or modality? Also training of staff, training of beneficiaries through education on what to expect. We know that this surge we've never seen anything like this before. So there's going to be different rules and different ways of operating, and the training and the guidance that CMS provides will be very helpful. Language requirements. For us, that is a big focus. People who have LEP or living with disabilities or require culturally adapted messaging. This will be really critical in getting people to engage. What works for somebody in urban Las Vegas is going to be different from somebody who lives in a very rural location, who may not even have broadband access. So the language and the cultural adaptation necessary is going to be a big factor. And then the last, which is probably one of the largest question marks right now, is how do states and plans support this from a customer service perspective? Is it, chatbots? Is it people just getting on the phone and answering questions? Do you staff up with other live resources? Do you use social service organizations to help funnel some of this, some of the questions that are coming through? So that to us is still an outstanding question. Suzanne, how do you think about the customer support component of this and responding to a huge influx of questions?
Yeah, well, I will say it's a challenge, right? And I think states are all struggling with workforce challenges right now. I mean, we see it in the healthcare industry broadly, but we also see it in state workforce. So I think, all states are trying to gear up and thinking about multiple strategies, contracting out what you can, borrowing employees from other agencies, you name it. I think there's a lot of creative thinking going on right now, just kind of given some of the many vacancies that exist in state governments. But I will go back to the top one too. I think the renewals and ex parte and the technology piece too, I think that by its very nature helps, take some of the load off of the need for more manual processes. And if you have challenges in terms of workforce and just knowing that there's going to be a huge influx, like to the extent that you can do more of the work electronically without having, as much of an intensive hands-on process. I think that's also a really important strategy.
So if we take anything from this, I think there's 3 key takeaways. The first is there are many ways to be proactive before the expiration of the public health emergency. Education is absolutely critical for states and plans to start to deploy so that you prepare your members and beneficiaries for what's to come, what to expect, and to know that it's a trusted communication that is absolutely critical for their health and well-being. Suzanne?
Yeah, I agree with all that, Sarah. I think that's absolutely what's critical. Like, we still have a little bit of time, again, uncertainty around when all of this is happening. So I think just really the proactivity and having discussions and conversations like today's right now to try to get, information out and let people know that this is coming. We're not exactly sure when it's coming, but it is going to be, again, be a huge coverage event, and just really focusing on getting all of the different stakeholders and partners together to help. I mean, again, I think so many people are committed to making sure that there aren't coverage losses, massive coverage losses, and getting people to the right form of health insurance is just really critical. So again, just working together collaboratively with plans and providers to get these complicated messages out in easily understandable ways is really critical. So just again, appreciate the opportunity to talk about this today and acknowledge the uncertainty that is definitely there around timing. But I think, just making sure that we're talking about it. And what we do know today is that having updated contact information is absolutely critical. And then also these other strategies around multiple forms of communication and how we can all make that happen as quickly as possible to keep Americans covered.
One of the things I applaud that you're doing, Suzanne, is just kind of a team approach with the health plans. To me, that seems to be really successful compared to some of the other states that we've spoken with, where it's kind of a more of a kind of who's in the first spot kind of play and who's on first. So I really applaud your efforts to kind of bring in stakeholders, as well as thinking about, as a third strategy, a really specific and detailed member and beneficiary engagement strategy. I mean, we think a lot about this in terms of flu, COVID vaccination, gaps in care programs, all of the things that drive members to take action that are, in their best interest and for their health. But at the end of the day, this is the same exact thing. It's just critical and table stakes for this population right now. So thank you, Suzanne, for joining me today. I always appreciate talking to you and your perspective. I see there's a flood of questions that have come in, and so I will start to read a couple of them, and Suzanne, maybe you and I can answer some of them. Is the Nevada site where members can go in and update their information addressable and compatible with smartphone, mobile, or is it only via desktop or laptop? So is it mobile enabled?
Yes, it is.
We have another question on, I'm working with frontline providers who are starting to plan how to promote awareness within their own organizations, so patients are getting face-to-face information from multiple resources. I guess the question is are you seeing the face-to-face awareness happening, or is it more, telephonically or digitally?
I think it's all of the above. And I think, every state's different, every state's unique. In Nevada, we just actually re-procured our managed care contracts. And had a new market entrant. So we've been seeing more face-to-face than we have historically, but it's largely related to that. And I think, using everything as an opportunity to provide information on this is coming and make sure your contact information is updated via all the different channels. But I think, that's really pretty state specific and variable, but we do know that all of those opportunities are required under federal regs, and different things work for different people. So I think, I'm sure there's research out there on like which populations and age demographics and all the rest of it. But I think, just making sure that we have something available for all the different modes, and knowing that people are in different places and have different circumstances.
So an interesting question that came in is, do you allow the health plan to update member information on Access Nevada on behalf of the Medicaid member? So if they have more updated information, what do you do with it?
Yeah, so we're working through that right now. It was somewhat new to us, and again, trying to evolve all of our processes to get the most updated information in all the ways that we can. So we are working, and again, I alluded to this, but it's not really helpful to a lot of people that there are all these different layers of bureaucracy in state government. So it's not actually our division, that is the eligibility division. So we get information from the managed care organizations and coordinate with them but we are now working through that process of whomever has the most updated information, and also made more complicated by things like we're an integrated eligibility state. And so, thinking through SNAP and TANF, and there are a lot of complexities, but at the end of the day, we're working to make it happen and to get as updated of contact information as possible. So that's been new and different. And I think previously it's always been like, for the system of record to be updated, there had to be direct contact with the beneficiary, and kind of working through, changing roles and opportunities to make sure that, we're all focused on the same goal and objective, which is to keep eligible people covered. And so we're kind of living that in real time right now.
I know you are. You live and breathe that right now. Another question, are eligibility divisions considering using a vendor to provide updated contact information? And if so, can this information be used independently without verifying it with the beneficiary?
I'm gonna have to defer on that. I have heard that there are eligibility vendors and there is a process for that. I'm not the expert on that, Sarah. I don't know if you have more information, but I could follow up. I've heard a little bit about this, but I'm not deep in the weeds of how that works. I don't know if maybe you have more information on that piece.
Yeah, in our conversations with states, the data append that is happening has been really central to the conversations. The need to get the most updated contact information from third parties is a really valuable resource that plans and states are kind of grabbing onto as the first step in the education process, and making sure that that is stored, validated, and that the member preference is also recorded as part of the engagement and the outreach with the beneficiary. I'm looking at my time. How do you often see people who don't have a phone and address those situations where if you can't reach somebody by phone, what do you do?
I'm sure that there are instances of that. I'm not, that close to the process, but I'm sure that there are situations where that happens. Again, kind of removed from that situation a little bit, but would be happy to go back and talk to our team and see if there are thoughts or strategies or ideas to share and follow up.
Great, thank you. Interesting one came through. So if somebody's on the phone with their care manager and talking about this issue, or if they got information that they have questions about, can the care manager log in to access and update the member information? I would assume that the beneficiary can give them their login information to update it. But is there anything that you're considering around third parties actually logging in to update the contact information?
Yeah, I think we're like, again, in real time working through a lot of these questions. So I'd have to follow up with our systems team. I'm not exactly sure how that process works or if we've gotten there yet.
Yep,
But
absolutely.
it's a good question.
I think we've answered most of the questions. I apologize that I haven't typed in answered, but most of these have been addressed. If there are no other questions, would love to thank everybody for attending today's webinar. Suzanne, thank you so much as always. Just a delight to participate in this with you. And we'll also, Icario will send you a really helpful article on Medicaid redeterminations after this webinar, in addition to the recording of the presentation. So thank you, everybody, and good luck with the process. Talk to you later.
Thank you, Sarah. Thank you, Suzanne. And again, thank you to attendees for joining us today. That was a great presentation. And with that, everyone have a great afternoon. Thank you.